Bonjour pour qui fait que nous, si vous faites à la télévision là, vous nous de Topik Konversasyon. De bonjour Cécile. Pareil, mon Cindy, puis bonheur. De Topik aujourd'hui, nous pouvons joindre avec des docteurs qui sont sortis dans des cliniques privées qui pour donner nous un peu plus l'explication, votre réaction, l'opinion, qui moyen autres peser sa situation COVID-19, étant donné qu'ils ont une clinique privée et ont des private practitioners. Et aussi, nous pouvons tous un petit peu le sixième vaccin, qui ont l'opinion, le vaccin Sinopharm. Alors, au qui de la cour, pas hésiter, même si nous topic pour un qui en anglais, pas hésiter pour texte nous, quand texte nous créole, quand nous causons nous créole, et nous, non, on va faire sa translation et on va donner la réponse qui est nécessaire, c'est tout, ou qui est habitué à faire sa visite pour une bonne clinique privée. Alors, aujourd'hui, le plateau avec moi, c'est Dr. Bibaka Ranjan, qui est dental clinic, qui est dental clinic en Sopé, et aussi Dr. John Solomons, qui est general practitioner, il aussi est dans clinique en Sopé, et clinique en Sopé est privé côté Dr. Mouti's Family Medical. Dr. Ranjan, mon mazine, je rappelle depuis 2019, il vient et Dr. John Solomons, lui, est nouveau, et alors, c'est eux qui pour cause avec nous. Alors, eux qui fait sa clinique en Sopin, clinique privée, de sortie que Dr. Mouti's Family Medical. Alors, là, il y a un moment pour dialogue avec nous. Là, bon matin. Dr. Ranjan, Dr. Solomons, good morning.
Good morning.
Good morning.
How are you too?
Fine, thank you.
Good, good?
Yes.
All right. I was just talking to the people of Seychelles. I was just telling them that this interview will be one in English, but they can talk to us, text us in Creole, and then I will do the translation so they can get a better understanding for their answer they are looking for. So as a private clinic and private practitioners, you two, how do you manage your practices or services during this COVID-19 pandemic?
Well, actually, in line with the directives and guidelines from the Ministry of Health, Seychelles, we've been our clinic has been able to establish an SOP, which is a standard operating procedure, particularly during this COVID-19 outbreak. The SOP is for all health workers in the automotive clinic, including the doctors, dentists, the pharmacists, the nurses, and all health staffs, as well as the patients and the relatives coming to the clinic. We all believe that everybody has a role to play in order to curtail the spread of this COVID-19 virus. We have been able to establish, as part of our SOP, we've been able to establish a telephone line for the patients, for them to be able to communicate with us prior to their visit to clinic, so we can ask some questions and tell them what they're expected to do upon arrival to the clinic. Like, they should make sure they have their face mask on and get their hands sanitized upon entrance and all that. Then temperature checks will be done. So adequate history taken briefly before their arrival. Then we have also made it possible for our staff to put on face masks at every point in time throughout this period of COVID, and then maintain adequate social distancing between staff and patients. Also, when you talk about the settings of the clinic, we have been able to also rearrange that and make sure that the seats are well separated for adequate social distancing between staff and patients. Then we've been able to train staffs to have a knowledge of IPC measures, that's infection prevention and control measures, in order for them to know and identify these signs and symptoms of COVID, to be on alert for each and every person that walks into the clinic. And then we've been able to provide the POS machine, that's point of sale machine, to help patients to pay, to avoid contact with money and all that. Then we've made arrangements too for the cleaning of surfaces, which is done at very short intervals, at least 4 times a day, to make sure that everywhere is disinfected appropriately and the wastes are properly disposed. Yeah, so we have been following the guidelines from the Ministry of Health, and we've been doing well, and it's been working for us. And so far, we've not recorded any case in our clinic. we hope to keep
Haven't
on.
recorded any
We've
cases.
not recorded any COVID case in our clinic, and we'll keep pushing further.
Yeah. And on your part, Dr. Ranjan,
Yes.
because, you know, dental
Yeah.
department, we're talking in the mouth, we're talking about teeth, it's more risky.
Exactly.
How do you manage that?
See, like the basic try is similar like the medical, we always do the telephonic trials. Once we get that patient hasn't traveled abroad or any contact with any infected patient or any infected family or friends, then we appoint them. Without appointment, we are not seeing any patient. Okay, once the patient comes, we usually give them a hydrogen peroxide mixed with water to gargle the mouth or with betadine, just to, even if they are infected, even if they are asymptomatic, to lower down the viral load. Okay. So me and my nurse, we both are wearing a disposable PP gown and face mask, N95 mask for any kind of aerosol protection for the mouth.
aerosols.
And then we are wearing a face shield to cover 360 at least, to cover like our face and eyes and everything. And then we are doing all the procedures. And after each and every process, we discard whatever we have used for this patient. And so you see, like in any chamber, any operatory, we have a closed, so it's very difficult to keep the air circulation. So what we are doing nowadays, we keep the windows open and we use air conditioning once in a while, so that even if someone comes with a virus, we still have this air conditioned air in and out, so to reduce any kind of possibility to acquire infection. And we are giving ample amount of time between one patient to other patient. Once patient leaves, we have half an hour for the next patient to see, like that.
So do you like sanitize,
Of course.
disinfect after each patient?
Yeah, see, like COVID-19 is an enveloped virus. Okay, it's very easy to kill if you know how to do it. So we are using a hospital-grade disinfectant. Okay, a virucidal, bactericidal, and after each and every patient, we clean all the surfaces. Okay, our like our keyboards, our computer, our desk, like all the chairs and everything. And then after cleaning, we wait for some time, then we take the next patient, like that. And whatever instrument we have used, we have a autoclave machine in that we autoclave it, and then we use the next one, like that.
So in a day, a normal day like today, now, how much patient can you accommodate?
Well, we have restricted the number of patients that come into the clinic. Like we'll make visits to clinic on an appointment basis, based on the directives. Then at a particular point in time, we accommodate about 10 patients.
In a day?
Not in a day, in the clinic,
In the
at
clinic.
a particular point in time. Okay? But in a day, we have up to about 50 patients or so.
50?
Yes.
In the time of COVID-19?
Yes, it has actually dropped, but we have up to 50 patients a day now. Yeah.
So you two, how do you protect yourself? How do you protect yourself from COVID-19? What do you do?
What we do is we make sure we, as directed by the Minister of Health, Seychelles here, we make sure we put on our PPE, which is our personal protective equipment, especially when we want to attend to a patient. We put on our face mask properly, wash our hands before attending to any patient, put on our gloves. We can also use hand sanitizer to sterilize our hands. Then after examining the patient, then we sterilize our hands and discard appropriately.
Do you recommend a screening process for those entering the facilities, the clinic?
Of course.
Yes, we have, upon entrance, we have a triage desk, which is at the reception. The receptionist takes the temperature of every person that walks into the clinic, and it's recorded. All the patient information details are recorded on a daily basis.
So at the dental department,
Yes.
how will your treatment be?
So like after the first screening at the reception, we also do exhaustive medical history checkup, like if the patient has any kind of debilitating disease or like any systemic disease or something like that, and we also see that if the patient really needs a treatment at the point, if the patient is in severe pain or something, like if he's having a swelling, bilateral swelling, or if the patient is is having difficulty in breathing like that, then we treat them. Otherwise, if the patient really needs something cosmetic, then we try to give them appointment later on like that. So we're trying to manage as much as we can with the emergency cases like that.
Talk to me about the waiting area. Is it the same area for both departments? How do we manage it?
Well, we have a common waiting area for both the patients coming to see the GP, which is me, and then for the dentist. But it's well separated, actually, so that there's adequate social distancing. And then, yeah, that is it.
And for us, these the patients are very much educated. You know, they are like very concerned about their own health also. So for us, we are giving appointment only. You know, like if I give appointment to a patient at 8:30, they come at 8:30, and then if the next patient is at 9:30, they come only at that time. So we don't, in dental, we don't have any patient waiting outside. So they are very much safe to come to the to the clinic and get the treatment done.
Exactly. So we try to see the patient as fast as we can so that we don't allow them to sit and wait. So it's not always occupied every time. We don't allow it to be overcrowded.
Yeah, and once any dental patient comes, they come after the screening, they come directly into the room, and they don't have to see anybody else apart from me and my nurse.
So how do you get the state or the local health department involved in your patient who has COVID-19?
Oh, actually, what we do is when a patient walks into the clinic, a brief history is taken, upon entrance. Then if there is any history of fever, cough, or if the patient has been in contact with any confirmed case, and all that, then if the history is suggestive of the case definition, if it meets up with the case definition, what we'll do is the patient is directed to the isolation room. The patient is directed to the isolation room, and then I'll be notified. I'm the focal person. Then I'll put on my PPE appropriately, and then I'll notify, I'll go and see the patient, ask some questions, then I'll contact the disease surveillance and response unit and wait for further instruction. Then they will now
What are the further instructions?
They might tell us, they might ask the patient questions. Thereafter, they can now send the rapid response team to come and pick up the patient.
How long that take?
Well, as fast as they can.
As fast as they can?
Yes.
OK, we have a text this morning. Bonjour, peux faire un petit commentaire sur l'introduction qui nous fait que ça des docteurs là bon matin. Il peut nous que c'est cela pas comprendre anglais qui m'a hier ou peut faire refaire ça à l'introduction, juste pour une petite remarque. OK. Qui m'on peut dire c'est qu'aujourd'hui les docteurs ils sortis d'une clinique privée et ils peuvent cause un petit peu avec nous la bonne prévention qui m'a hier ils peuvent faire dans d'autres cliniques. Nous pouvons causer un petit peu le 12 and don'ts qui m'a hier recevoir d'autres patients. L'éducation qui m'a donné en ce qui concerne la situation COVID-19, qui m'a dit sa situation COVID avec les bonnes patients qui entrent et sortent tous les jours dans notre clinique. Nous pouvons causer ça des docteurs, sorti que le docteur Mouti et sa clinique privée lui trouver en sopé un dentiste et un general practitioner qui recevra client. Voilà, si on a une question, this texte nous en créole et moi va translate et les docteurs là va répondre et m'a retranslate en créole. Vous ne pas besoin hésiter pour cause avec nous. Moi souhaite qu'ils m'ont fait déclarer la bon matin. I was just talking because they are asking what topic we are talking about. I was just telling them. And regarding the protocols of the health guidelines, what are the do's and don'ts?
Well, the do's and don'ts may include, for the do's, we expect patients to, try to call us to book an appointment before coming to the clinic. We expect patients to put on their face mask before coming to the clinic. Then we expect patients, these are the do's, we expect patients to make sure they sanitize their hands before entering the clinic, and then they should also try to sit down and maintain social distances even inside this clinic.
In the event that one patient has just come in, probably a toothache, with no appointment, haven't booked an appointment yet, what do you do? Do you accommodate them or you just give them an appointment, send them back home and
it's
come?
like if he's really in pain, we have to see. So what do we do? If at that point I'm not seeing any patient, If by chance if I'm free at that time, then we will take them inside and we'll just see what we can do. Maybe we don't operate them at the moment, but we'll give them medicine and we'll appoint them for later appointments like that.
In your case, Dr. Summons?
If a patient just walks in like that, definitely the patient has to follow the protocols. The patient has to, if the patient doesn't have face mask, we'll give the patient face mask. We'll ask the patient to sanitize their hands.
And he doesn't have an appointment?
Yes, if a patient comes without any appointment, of course, we welcome the patient. We'll tell the patient, if the patient has face mask, then the patient should go ahead and sanitize the hands, and then temperature checks are done, and then history and questions asked. If the patient doesn't meet up with the case definition, then we'll go ahead and see the patient.
Now, let's talk about the staff members. What if a staff member shows symptoms of illness?
What happened is that in line with the guidelines from the Ministry of Health, we have been directed that if any staff member that develop any symptoms, maybe respiratory symptoms, or cough, shortness of breath, and others, the staff should stay at home, isolate, and then call 141 and wait for further advice.
Has it happened yet?
No, it has not.
And even if someone is if they are having asymptomatic symptoms also, okay, like if they don't have any cough or any body ache and like that, even if someone comes to the clinic, every morning we do temperature check, and if there's a spike in the temperature, then we ask them to go back home. But till now, none of that happened, and I think we are the only clinic who doesn't have a single COVID cases so far, and we all are safe at the moment, and we are lucky with that. Because we are such a small community, like we have very less number of clinics. And
How do you minimize risk?
Well, we still adhere to the public health guidelines, by putting on our face mask. Okay, it helps a whole lot. We maintain social distancing. We avoid crowded areas. We try not to touch our eyes, our nose, and our mouth regularly. Then we'll try to make sure we clean surfaces that we come in contact with on a regular basis.
And I think if we follow the basic guidelines, I think we all can be safe, And plus, the main thing is like after the work, we are not going outside anywhere. That's one of the biggest point why we are safe. There's no socializing with the people outside. We are taking things very seriously. No friends, no family at the moment, till we get better,
So your patients, what are their reactions? What are they saying?
I feel in the society, it's such a small society we have in Seychelles, and the people are hysteric at the moment. There's history of the COVID-19, People are scared, and even if someone is having any kind of symptom like fever or something like that, they are scared to report that. They're scared to go to the hospital to tell the doctor, maybe they think that they have the virus. So I think the people should be less scared and they talk more and they go and report if they have any kind of fever or something like that. Maybe you don't have the COVID-19, maybe you have just a normal flu.
Yes, it's scary because it might not be COVID, but I'm coming to the clinic for other illnesses.
Exactly.
But in my mind, I'm thinking of COVID.
Yeah. And I think this is the right time when people should stop smoking or drinking a lot, because that's things. These are things that actually hurts the people most,
And I think people should also make sure they get their information from right sources. It will help, reduce the fear.
Just give us an example of the right sources.
Like the Ministry of Health, SBC.
SBC.
And also WHO websites,
exactly.
Yeah. It's very helpful.
We have a text. Okay, it said, hi. Also, the mask we are denying our body oxygen. Is it okay for our health? And is contagious disease really existed? There's two questions. First is the mask we are wearing every day. She or he said it's denying our body oxygen. Is it okay for our health? That's the first question. The face mask.
So, bonjour. So, I will say that there are so many studies done that because people are concerned about that since a very long time, And there are so many studies done that even if you wear a mask and you go for a run, there won't be any drop of oxygen level in your body, you know. You can wear an oximeter and you can check by yourself. There's no denying of oxygen for yourself if you wear a mask. So don't worry about that.
OK, pour aucune texte, ou première question, demander s'il y en a aucun l'oxygène, pas pour tomber, par le docteur peut expliquer, le temps où peut mettre un masque, même si vous mettez un la zone, so ou body flow pour l'oxygène, il pas pour descendre, OK, il pas même si vous pouvez tailler par il dit, ou capable toujours mettre un masque, il pas pour venir un problème. The second question is, and is contagious disease really existed?
Yes, of course, it is. You know, we have to take it serious. It is existing, it is real, and that's why the World Health Organization has, you know, called it pandemic. So it's real. So we are not taking it lightly. We have to adhere strictly to the public health measures and make sure we don't get it, because it's not a good thing to experience. So I think prevention, they say, is better than cure.
On s'est posé, docteur, répondre aux questions là, on demandait si any contagious disease really existed. Docteur dit oui. Et vrai, totalement vrai, que sa maladie est contagieuse et oui, 100%, il existait. Voilà. Aucune question qui est dans ce texte, nous, bon matin, même encore pareil, mon pédiatre, et dans ce demande docteur, et les autres vont répondre nous. Now,
Yes.
I have this question. We are now on the vaccination program in Seychelles. In your own opinion, as two private practitioners, what do you think about the Sinopharm vaccine?
Well, I'll start with the definition of vaccine in a simple way. Like, you know, vaccine are substances that when injected into our body, it helps to train our body to develop antibodies, you know, and immunity to a particular virus, or, you know, as the case may be. Then when it comes to Sinopharm vaccine, I believe that vaccines generally, they undergo processes. They have both preclinical trials, clinical trials, as well as some phases for them to be approved for use. So when it comes to Sinopharm vaccine, it has been approved by the Ministry of Health Seychelles to be used for the people of Seychelles within the age group of 18 years and 60 years. And we encourage individuals within this age group to use it. The reason being that during the clinical trials of the vaccine, it was used within these age groups, these 18 to 60 years age groups, and it works perfectly. So we encourage individuals to, within this age group, to get their
So
vaccines.
you encourage the people of Seychelles to take their shots?
Yes.
And Dr. Ranjan,
Yes.
you are one who has already taken the Covishield
yeah.
vaccine. Tell me, talk to us about it.
So like, see, all the vaccines are good, you know, like all the vaccine which is introduced in the society after like exhaustive research, you know, they don't just release any vaccine just like that. So the Covishield has, it's manufactured by Oxford. It was developed by Oxford University and it was manufactured by AstraZeneca, okay, vaccine factory, you know. And then it's been, so far, it's been like administered in more than 35 countries, okay. It is regulated by WHO also, approved by WHO also, and most of the patients are having some side effects like fever or like pain in the body ache, but these side effects are not bad, to be honest.
Are they normal?
Very normal. This is very okay to have those side effects. It shows that your body is showing some kind of response towards the foreign bodies, and it is showing that your body is going to make antibodies against the virus.
Did you get side effects?
I did have slight bit of side effect, like I had a pain in my arms and I was like not having this sleep in the night for one day. And after that I was okay, but that's very normal.
It is normal?
Yeah, it is very normal, not to be scared of. If you see, like when we were a kid, we had so many vaccines, and that time the kids used to cry for days and days. They used to have a like swollen hand and they used to have fever. But at that time our parents were not scared. Then why are you scared now to have those vaccines? So having vaccines is nothing to be scared of, you know.
Ok, voilà, c'est celle une question qui m'a tiré en même temps qui m'a posé avec les docteurs. Nous peux demander aux autres l'opinion. Les vaccins qui en ce moment nous c'est celle, nous peut penser ça c'est Covishield et aussi vaccin Sinopharm qui Dr. Ranjan lui il déjà prend son vaccin Covishield. Il y en a petit side effects, pareil nous dit, mais seulement il pas pour la langue, un petit gratté, un petit quelque chose, un petit rougeur, pareil puis dit, mais seulement les docteurs là bon matin, les autres encouragent nous pour aller prendre nos shots, pareil nous dit, pour nous aller prendre nos vaccins. And doctors,
Yes.
anything that you want to add regarding your private clinic that you want to share with us this morning? Maybe for your clients, your patients?
See, like so far, like we are really having a strict protocols to see a patient, and none of the doctors, none of the patient were infected so far, and I think we are doing a right job and good job for the people of the society, you know. And I think they should come if they have any problem. They shouldn't be scared. They shouldn't sit at home. If they have fever, if they have any type of problem, you know, we have medical facility, we have dental facility. We can take care of you, because at this point, even the Ministry of Health, even the government hospital is having too much load, you know. As a private practitioners, we can share that load and we can take care of the people. We are united to fight this pandemic, right?
Do you work collaboratively with the Ministry of Health?
Of course. Suppose like we have some kind of complex cases that we can't do or we don't want to do, we refer those cases to the Ministry of Health, the government hospital, and they take care of that. And I think this is where we are working very closely at this point.
We encourage our patients not to entertain any fear. They should try as much as they can to, you know, book an appointment, call us on phone. You know, if they are scared, they can call us on phone.
I tell you,
book an appointment.
right now, the
Yes.
people are very scared.
Yes.
Yeah.
We understand. But the thing is, we have to try to keep on with this, adhering to these guidelines from the Ministry of Health, because that is the only way forward, and it's working, okay? So they have to try as much as they can to call, if possible, to call for appointments. Then when they are coming, they should put on their face masks. They should come, then make sure they sanitize their hands, you know, the temperature checks and all that. So they shouldn't panic. They should come. We'll take care of them. And there's nothing to actually be scared of if you do all those things, you know.
Speaking about that, what tips would you give your patients right now, the patients who are in fear, to prevent the spread of COVID-19?
See, like if you really don't want to get infected, so what you can do, just eat healthy, avoid drinking, smoking, and try to be at home. Don't go outside. Don't even try to socialize with your neighbors, you know. The less humans you see, the less human are going to interact, the less chances you're going to be infected.
I want to draw a line
That's
here.
the very simple thing, you know. And if you are like scared, if you have any kind of phobia at the moment, try to do some meditation, try to do some yoga at home. And even you can go to the nature, you know. Try to go to the mountain, try to hike, try to go to the beach for a walk. And not with people, just by yourself, you know. That's the best thing that you can do at the moment. You're in Seychelles, you're in paradise. What else you want? The people in the world, they are having difficult time, but you are in such a place where you can utilize it and you can keep yourself safe. I think if you follow these simple things, you're not going to get infected, for sure.
It should be okay.
We are safe till this point.
Yes, we are safe, so nothing to be worried about. So we encourage the patient to come to the clinic. They shouldn't be scared. We are safe at the moment. We've not recorded any case. We are trying, and it's working. So they can also do the same thing, follow the same outline, the directives and guidelines. Things will be fine.
And respect the do's and don'ts of the private clinics.
Yes.
Yeah, exactly.
You've said that drinking. Is it true? I want both of your opinion.
Yeah.
Is it true that they say that when you drink, it keeps the COVID away?
No, not true.
Not true?
It's not true. It's not true.
If you see, I don't know if you've been to the vaccination center or not. Okay, all the vaccine leaflets from any manufacturer, like even Sinopharm or the Covishield, they all say when you get inoculated, when you get vaccinated, don't drink.
Drink alcohol.
It reduces your immunity, immune level, you know. So drinking is never a good thing if you are vaccinated. If you are not vaccinated, it lowers your immune level to fight any kind of virus.
Yeah.
So it's false.
Yeah, it is.
false.
It's such a big, gross thing, you know. Yeah.
But if somebody is going to take the vaccine, say tomorrow,
Okay.
and today he wakes up and decided to have a couple of glass drink. Is it okay
No,
and tomorrow to take the vaccine?
No, I would suggest that you should avoid, if you take like just for 1 or 2,
How many days?
at least for a week, you should avoid it.
A week?
Before,
Avoid
yes,
for a week.
before at least. And suppose you have a first dose now, and after 4 weeks you're going to have the second dose. Try to avoid the whole this phase, you know. Try to avoid at least for a month or 2 months.
Yes.
You're not going to die without drinking.
You think?
Of course.
Yes, and also I think before someone should go for vaccination, the person should contact the vaccination team to book an appointment, and then when they give you this appointment, you should work towards that. You know, try to avoid those things that may affect the vaccine, like alcohol and some medications, because there are some medications that affect the vaccine. So it's better for the person to contact the vaccination team, you know, then avoid alcohol and some medications, and also let them know the medication one is taking, if any. You know, there are some people that are on some medications, so you have to let them know. So when you're trying to get the vaccine is to prevent you from getting this COVID. So why would somebody want to take alcohol? You see, so
there is a group of people that would prefer to drink than to take the vaccine.
That's true. That's true. And that's just not the drinking, right? The drinking, it's okay, but people are going outside, you know. People are meeting their friends and family. That's one of the biggest thing that they shouldn't do. I feel bad about that.
You feel bad?
Yeah, like people are going outside and meeting people. They shouldn't do it, at least for a few months, you know.
But we are not listening.
Yeah.
This is the problem.
If you listen, then there won't be any cases in Seychelles.
Yeah.
We maintained that till the December, you know. If you try, we can do it from onwards.
Okay, doctors, that was our interview for this morning. Before we come to an end, I'll give you the last word.
Yes.
For the private clinics, the clients, patients that you see every day, what you want to tell them?
Well, I encourage our patients to, firstly, they shouldn't fear, they shouldn't be scared. They should try to adhere to the guidelines given. They should put on their face masks regularly. They should make sure they don't touch their eyes or try to minimize, you know, touching their eyes, their nose, and their mouth. They should try to avoid crowded places. They should try to wash their hands frequently. And then they should, most importantly, they should get their information from right sources. This will help.
On your part, Dr. Ranjan?
So like at Dr. Murthy's clinic, we are trying our best to keep our staff and the clinic safe, you know, and sterile. So patients shouldn't be scared to come to us, okay? And if you want to keep yourself and family safe, then follow the guidelines and try to be at home. Don't go outside all the time, okay? And eat healthy. That's it. You'll be fine.
Dr. Solomons, Dr. Ranjan, thank you so much
Thank you for
for
having us.
coming this morning for our live conversation. You as private practitioners, to share your opinions about the private clinics. What do you do? How do you manage your services and practices in the time of COVID-19? Thank you so much and have a nice day today.
Thank you so much.
Voilà, Cécile, nous t'y cause avec Dr. John Solomons et aussi Dr. Boubacar Ranjan, qui nous t'y cause un petit peu les autres côtés comme un bon private practitioners dans une clinique privée. Et justement, nous t'y cause le clinique privée qui trouvait en Sopin. Un, il y a un dentiste et l'autre, il y a un general practitioner. Un petit peu l'opinion, qui m'a les autres situations COVID-19 comme un bon private clinic. Voilà, nous gagnons un petit peu l'information. Et après, nous avons un petit peu, nous avons le vaccin Sinopharm aussi qui m'a y fait. Alors, ça, c'est une topic conversation pour aujourd'hui.